So, what exactly do people do in public health? Monday, April 7th is the first day of National Public Health Week, which, if you don't know, is a week put on by the American Public Health Association to celebrate the work that public health workers do and bring attention to various health issues in the United States. GW has a variety of events going on related to National Public Health Week, and I'll be posting about those later, but I just wanted to come on here and talk about what it looks like to work in public health and what exactly public health is as a profession. If you don't know me, hi, I'm Nadia. I'm an MPH student. I work in public health. I've also worked in journalism, and this is my YouTube channel, and I hope you'll keep coming back for more. So, without further ado, let's get started. So, first, what is public health? Public health is basically what it sounds like. It's protecting the health of populations, of communities, of neighborhoods, and it really focuses on prevention. There is some overlap of healthcare. In the early days of public health, health departments really focused a lot on getting services to people. And of course, there are a lot of nurses, doctors, clinical professionals who work in the public health space as well. But overall, public health is seen as being about the big picture rather than individual interactions with patients. I'll talk a bit more about the delineation between medicine and public health in a bit, but first I want to talk a little bit about my background and how I ended up here. Like I mentioned in my introduction, I am pursuing a master's of public health and health policy, and in undergrad, I studied biology and global health. In undergrad, I was reasonably certain that I wanted to do research after graduation, but whenever I brought up what I was majoring in at school, the first question I would usually get is, "Oh, so are you pre-med?" It wasn't entirely unjustified because most people at Duke who are majoring in biology and global health are somewhere on the pre-health track, but that didn't stop me from finding it annoying. I did consider going into medicine in the past, but after a while I realized it was not for me, and so I was in a position of trying to navigate whatever options there were in the health space while also trying to explain that to other people. So for me, the first path I explored was research. I was interested in working in a lab, I was interested in pharma and genetics, which I still am to this day, and I thought that would be my main path into public health, finding the underlying science to drive innovation. But rather than working in a wet lab, I ended up more on the social science and policy side. Research is just one thing that public health workers do, and they do it to drive future decision making and future discoveries that will benefit the health of populations. But public health workers also do a lot of other things. They write policies, they analyze data, they help with emergencies, they help people get access to services, as I mentioned earlier. They work in schools, they work in laboratories, they work all around the United States. And like I said earlier, there is some overlap of clinical practice. We need nurses to help us give out vaccinations, for example. There are even some public health positions that explicitly want you to have clinical training, which has invited some consternation from public health professionals who don't work in clinical settings. For example, some health departments only want leadership who have MDs, which has upset people who have MPHs or other public health degrees. I know from my perspective, there have been times where I'm looking at a job description and I read all the bullet points and I'm like, okay, I can do that. And then I scroll down and it's asking for someone who is an RN. And that brings me to my next point about working in public health, which is educational requirements. Over the summer, I took a course at GW on the health workforce, and one thing we talked about was the sociology of professions and how careers sort of establish themselves by establishing more standards to get into the profession, which also keeps certain people out. For example, medicine, nursing, physician associates, other clinical positions have certain standards established to sort of legitimize themselves and establish their role in the medical sphere. Public health has established its own standards over the years. For example, GW is a CEIF accredited school of public health, which means that our curriculum meets certain standards on what the public health profession believes public health students should learn. A lot of standards set by CEIF and also the Certification in Public Health, which is a separate body that gives people recognition for their skills, has been driven by the American Public Health Association, which I mentioned earlier. APHA is one of the main organizations for people working in public health, and they've done quite a few surveys over the years to understand what credentials people believe that public health professionals should have. Some people believe that public health is too broad to require credentials. Some people thought that we needed credentials to be involved in conversations around healthcare policy. Some people believe that MPHs and doctorates should not be required. There was a lot of opposition to requiring medical degrees. Some people thought that credentialing exams should be required. Despite all the disagreement, in general, requirements for public health jobs have been getting more and more stringent. I'm personally pursuing a master's because the jobs I was interested in required a master's degree. Not all public health jobs have such high requirements, particularly jobs working at health departments and in state and local government. But the problem with that is those jobs tend to be lower paying compared to jobs in the private sector or jobs that have higher degree requirements. The PHWIN survey has found that health departments in particular are having trouble retaining staff because of issues with pay, and then also the COVID-19 pandemic pushed a lot of people out of their jobs. There also seems to be some skepticism around people who don't have higher degrees. For example, Columbia University just put out a study comparing governmental public health jobs to jobs in the private sector. The study pointed out that governmental public health jobs, as I mentioned, tend to have lower education requirements, and their write-up said, I'm looking at it right now, the lower education level required for epidemiologists, statisticians, and computer occupations raises questions about whether government workers are well prepared for their roles. Seriously? The article does include the caveat that health departments might be relying on-the-job training, or they may be flexible in education requirements to attract a more diverse candidate pool, including individuals of less access to higher education or graduate degrees. But at the same time, I think the assertion that they're less qualified for that higher degree is pretty pervasive. Bringing it back to the sociology of the professions, public health is doing all this to legitimize itself as a genuine profession that's distinct from medicine and all the other professions. And yet, my professor for that class said that she still thinks public health hasn't established itself as a profession yet, which kind of sucks as someone who's in a professional degree program for public health. But at the same time, I'm learning that public health being so broad allows for a lot of opportunity. I work as a policy analyst right now, and there's so many places that public health workers can work. They can work at health insurance companies, pharmaceutical companies. I saw job postings at Disney a while ago for a public health manager. There's hotels, there's all kinds of places that I never even would have considered as an undergrad. There's also tons of places to get experience even prior to entering the workforce. In undergrad, I trained as a federal marketplace navigator, so helping people to navigate the Affordable Care Act healthcare marketplace, understanding what insurance plans were, and helping explain that to people. I'm also currently part of the local Medical Reserve Corps as a non-clinical volunteer, and in that role, I mostly help with health fairs and preparing for emergencies and things like that. There's a lot of work to be done in public health, especially out in communities. I do want to acknowledge, although there are public health positions in hospitals and the like, there's also been criticism of the medicalization of public health, which sort of pushes public health from its community focus to more individualized focus and getting people services through health systems, getting them access to social needs through health systems. And I will admit, being in the health policy space, there is a lot of focus on healthcare and what's going on in health systems, but there is a whole world outside of that. And I think more people should be willing to explore that. So to sum up, public health is everywhere, and there's lots of opportunities out there for people who are interested in this career path. If you enjoyed this video, be sure to like, comment, subscribe. I'll be posting more of my public health dispatch series in the future, and thank you all for watching.